currently a pediatric intensive care nurse. I work at a level one trauma center and educational institution, and I've worked there for about 2.5 years now. But I am celebrating 5 years as a nurse since this July, which is awesome. And thank you guys so much for having me here today. And I'm so happy to see all your faces and give you a little bit more insight on how I became a pediatric intensive care nurse and my journey in nursing. So without further ado, we can kind of get started on this since I know we have a 40-minute time limit. So just a little snippet that I already talked about, that I've been a nurse for 5 years. My journey actually started in the operating room. And when I'm not in the hospital wearing scrubs, you can find me out coaching field hockey with a local high school team or in the gym with my husband, just kind of working on some personal fitness goals. So that's just kind of a little rough draft of me. But I know a lot of you guys are probably here to learn as far as what I did in high school and then throughout college. So just to start with that, I actually, in high school, I wasn't quite sure what I wanted to do. And my mother actually told me, she's like, Katie, you cannot be a U.S. women's field hockey player. So you're going to have to get a job that will go to school and get to a career path that will get you a job that it will sustain you, that you can serve others. So kudos to Kline for really pushing me to do that. I actually was first introduced to nursing after completing my EMTB certification through my high school. And after that, it just exposed me to ED nurses. And I thought that it was just the coolest thing because as an EMT, you're really just packaging your patients for transport and getting them to the hospital as quickly as possible to get them managed by a medical team. So that's first sparked my interest there. I was also a hostess. So I think, that kind of experience went along with nursing because, we are there to care for our patients and their needs. And it is a lot about customer service. So the only other thing that I did that involved me with children while I was in high school was that I worked on a lot of sports camps. I did field hockey camps, track and field, and that just exposed me to children. My brother-in-law is actually a functional life skills teacher. And when I would come home on the summertime, he would actually have me come and be a teacher's aide in his classroom. So that also exposed me to children that might have developmental disabilities or Down syndrome, and how we teach them and get them the care that they need while they're in school. So that definitely sparked an interest in me for what I wanted to do. And around my junior year, after I finished that EMTB certification, that's when I started looking into college programs that had BSNs for nursing, although there are several different tracks to get into nursing, not just a BSN. I knew that I also told my mom, I was like, well, if I can't play for the U.S. women's team, I still want to play college field hockey, and I think I'm good enough to do it. So, we looked at colleges that had sport programs as well, and I settled on Lynchburg College. So this is just kind of a snippet. I was accepted to Lynchburg College and was accepted to play field hockey there. However, as far as nursing, your first year for that, you had to actually complete prerequisite requirements beforehand. So those were chemistry, nutrition, statistics, and then fundamentals of nursing. And those, your grade had to be, I think it was like a B+ or better. And then you had to take a TEAS test. My particular program used ATI to formulate those. So all of our study books were given to us through that. And in the springtime of my freshman year, I took my TEAS test and officially applied to the nursing program. So I was accepted, and in those short 4 years, I mean, at that time they felt so long, but really looking back, they were a blink of an eye. I did a lot of things around campus other than just sports. I was also in Greek life. I had a campus job. I actually worked in intramurals. And then I transitioned over to events crew, setting up for a lot of sporting events. And that just kind of helped give me a little extra money while I was working there and alleviated some burden with my parents helping me financially support me before going home for the summer and working with my brother-in-law. My senior year, I also did nursing governance. So that was organizing things for our nursing class and learning opportunities. Through Lynchburg College, I also had the opportunity to study abroad to Mexico for 6 weeks during the summer, going into my senior year, which was phenomenal and very eye-opening, and got to see kind of what their medical and healthcare system looked like down there, even though it was mostly traveling for Spanish and linguistics. That was still something that drew me to them in that area. And I had the opportunity to just kind of connect with people down there and talk about their healthcare system and learn some Spanish. My program also had NCLEX prep through ATI. I used ATI because it was required at the end of my senior year to study for the NCLEX. And they gave you kind of, once you took the final test on that 3-day seminar at the end of senior year, they gave you a score on what your percentage likelihood was to pass the NCLEX on your first try. So that was helpful. However, I did also purchase Kaplan, and I think between comparing the two, Kaplan was definitely a better prep for NCLEX than anything else. But it was pretty strenuous those 4 years going through the nursing program, but all in all, nothing that I couldn't balance or handle. And the school was really amazing about supporting athletes that were also studying for their courses, and accommodated for practice schedules and also the events for games. So I had a lot of support from my professors, a lot of support from my coaching staff in order to be a successful student and graduate on time. After school, I graduated in 2015, and I had started applying to jobs at the end of my senior year, kind of like at the beginning of my senior year, so kind of in like the November, December range. And one of my biggest recommendations is for those that are going to graduate, really start looking ahead at hospitals or institutions that you're interested in, whether you're going to go home and maybe live with family and save up some money and hopefully pay off those student loans quickly. Or if you are moving to a completely new town, or you found a love in a place where, your program is, those are all things that you want to consider and think about before you start to graduate, because then I know the institute that I applied to, I knew exactly where I wanted to settle down for a little while and where I wanted to move right out of college. So I looked at what their recommendations were and what the requirements were for their new graduate programs. So I actually applied very early because their application process started in November. And then towards January, February, they let you know if your applications had been accepted and when you would be interviewing for those, so that you could be ready. So that was, all in all, kind of a very stressful time, and there's several different resources out, and if you have questions about it, we can definitely talk. But unfortunately, the requirement was that I apply to 2 different jobs as a new grad at that institution. And they had one that was oncology, and that is where I actually really wanted to go. They had an application open there, and then unfortunately, they only had an application open for their operating room. My practicum as a nursing student was in the PICU, so I knew about the OR, but I did not work back there and have experience. I watched maybe like 2 surgeries my whole clinical rotation as a nursing student. And then I applied to both of them because that was the requirement that I applied it to. And unfortunately, 2 weeks before my oncology interview, that one dropped because they filled all the positions. So, I took it with a grain of salt because I knew I wanted to work at that institution. And I said, if this is what I need to do to get my foot in the door and work here, that's fine. It's experience, and I can only gain from that. And I actually ended up spending 2.5 years in the operating room. I specialized in pediatric general surgery, took care of any pediatric patients that were undergoing orthopedic, GI, GU surgeries, ear, nose, and throat, neurospine, thoracic, and my personal favorite was placing kids on ECMO, even though that's, not a great experience for like that patient or family, but it is, a life-saving treatment that we did. So I would scrub in with surgeons, and also circulate cases as a nurse in the operating room. But after 2.5 years, I just kind of knew that I needed a little bit more, and I started looking around at different applications, and I knew it really solidified my love for pediatric patients and caring for them. And I just needed a little bit more time with them because I would wonder a lot about how they did after surgeries. So after 2.5 years, I started looking at other applications and applied to PICU. But just so we can kind of talk about what the pediatric intensive care unit is, we care for critically ill children, and we do everything in our power that we can invasively to have these children survive. So that's age 0 to 18 is typically our cutoff. However, we have seen 21-year-olds. Average age, I would say, for patients that I have taken care of in the last 2.5 years, we see a lot of 1 to 3-year-olds come into the PICU, but oftentimes it's just this gradual up and down ebb and flow of, whether we get a teenager in or a really young child. Our common admissions are listed on the screen, anywhere from neuro, respiratory, and cardiac. Those are 3 really big ones that we see. We also, at my institution, we do transplants for liver, kidney, and heart transplants. We do get traumas in from time to time. And then we have a lot of surgical patients, patients that might be needing like a G-tube for feeding, our cardiac surgery patients, and a lot of times, sometimes neurosurgery patients. So we take care of a wide variety of those types of patients. And like you'll see in an adult unit or an adult intensive care, there's a neuro ICU, there's a transplant ICU, there's a cardiac ICU. When it comes to pediatrics, we're all in one. The only way that they ever really deviate, especially at my institution, is that, we have a very cardiac intensive program, and then we have a medical side that takes care of everybody else under the sun. And my patient ratio, I normally have either 1 or 2 patients. It just depends on their acuity, who I am stacked up with. So transitioning to the PICU, my motto really was that a goal should scare you a little and excite you a lot. And transitioning was very scary because operating room nursing is not the same as bedside nursing. However, it's just as necessary as bedside nursing. So if anybody's interested in the operating room, totally not dinging them at all. I had a great experience while I worked there. But when it came to transitioning, I did a lot of networking. I talked with people who worked in the PICU. I actually had a couple friends that worked up there, and I just expressed interest in what would make my application stand out because I was going to be an in-house transfer. So that had its perks because I was already trained to that institution. I knew the ropes. There was a lot less money involved with training me to the unit. So I really just worked on my application. I actually used a lady, a nursing lady who created her own side business called the Resume RX. She is fantastic, and she helped me out with my application and formulating that. And then I also went ahead and I got PALS certified That was not a requirement of the operating room. However, since I took on a leadership role within the pediatric general surgery team, I felt like having pals and being able to support my anesthesia staff in emergencies was very important as a circulating nurse and as a scrub nurse. So I went ahead and got that done, and I think that made my application a lot stronger. Just highlighted on my personal aspirations. This is why I wanted to do it and wanted to grow. And then highlighted what current skills I had that would transition and apply to the PICU. So my knowledge of surgical patients, how to manage them, like just in the OR setting, not necessarily long-term, just highlighting on those skills I thought was very important. And then with my application, they interviewed me and I was allowed to shadow the unit. And so I was able to see kind of what they did, ask the nursing staff what they thought about the unit and the culture there, which gave me a really good insight into them. And long story short, I was accepted. So since working there, I transitioned from a 40-hour work week in the OR, so 410s and a call schedule, to 36-hour week requirement. So that's 3 12-hour shifts. Sometimes more if you sign up for more. But I rotate nights and days currently. I work a lot more nights just because I like that flow a little bit better, but it's not that I don't mind days, I just prefer nights. There is optional call on my unit, so sometimes you can pick up extra if you want to make a little bit extra or if the unit needs. And then we also sometimes have to come out with critical staffing incentives where you get a boatload of extra money for picking up X amount of shifts. So intermittently we'll do that, but also just have to factor in resiliency stuff and making sure that I'm okay to continue working over 36 hours a week, because those 12-hour shifts are sometimes really exhausting. So my orientation period there was 8 weeks because I was considered a clinician too, which is over a year of experience. And I had also completed a nurse residency that was required by the institution. So that is officially what gave me my Clin 2 status. Of course, with every unit when transitioning, that should be an open conversation between managers and your comfortability and how you think you're transitioning to the unit. But overall, I felt like my orientation period was excellent. There were things each week and each shift that we were trying to accomplish in getting me exposure to several different types of patients. So identifying my strengths, identifying my weaknesses. I had 2 preceptors, 2 main primary preceptors, and then a handful of secondaries that would sometimes take me. And so just learning from each of those individuals on my unit was fantastic. I purchased the CCRN guide early through AACN, and that I think helped put together all the knowledge I needed to know into one nice, tiny, neat package. So if there was a patient that would come in, I'm like, oh, I don't quite know about like DKAs or diabetic ketoacidosis. Like I need to review that a little bit more. The CCRN guide really just helped me solidify those knowledge points and what I should be looking for, as well as the help of my preceptors. I also had to sign up for extra classes and continuing educations, and then CBLs, which are also just orientation pieces. So we had a lot of training courses on neuro patients and cardiac and transplant, and those are all things that I took at different increments. And then I would be signed off in our charge nurse book to kind of take care of those patients, or that I was educated enough to do so. The next biggest piece as far as PICU, because we do see a lot of congenital cardiac defects, was that I was trained to our TCV team, which is thoracic cardiovascular, after about 6 months on my orientation. That's a specialty training program to take care and recover post-op surgical hearts, regardless of what defect it is. So it could be a transplant patient. It could be as simple as they just have a hole between like their ventricles that gets patched up. Or it could be as big as they need to do like an arterial switch for patients that have their plumbing hooked up in the wrong areas. So those were 3 intensive courses that I took as far as open chest, placing patients on ECMO and managing them as a bedside nurse, and then taking an actual TCV class that went over each cardiac defect that we commonly see within our cardiac program. So after that, I was signed off after 3 admissions for post-op hearts, and one of those had to be a solo at the end, and with my preceptor just kind of acting as more of a helper, and me being more of the primary critical thinker in that situation. So I've been TCV trained for over a year and a half now. Once I had enough experience, I think it's a year and a half, AACN puts out the requirements on what you have to accomplish to test and be critical care nurse certified. CCRN, and there's adults, there's pediatric specialties, certifications within AACN. So that I studied probably like since taking my job in the PICU, and then 90 days, I finally just bit the bullet and was like, I'm going to study for this, and I'm going to test and take it. And I highly recommend for anybody that's, in a critical care setting to get this certification, because it really showcases that what you're doing as a nurse, and that you care to show that you are up to date on those standards as a critical care nurse. It just solidified my knowledge base, and also gave me a boost of confidence that, I knew what I was doing when I was taking care of these patients. This is kind of what a day in the life looks like for me. And on the time schedule, whether, I don't know if you guys use military time, but if you don't and you're interested in anything medical, start learning how to read military time. That's a big thing. Whether it's, whether I'm working night shift or day shift, I'm always up at 4 a.m. Typically I'm working out. By 5:30, I'm showering and I'm packing my bag or my meals. And then by 6 o'clock, I'm out the door to get to work. At about 6:45, I'm on my unit taking a look at what my patients are for the day, and, chit-chatting with coworkers. And then at 7, we actually do a grand board report, and we go over a synopsis of each individual patient on the unit, so that if an emergency happens, we know just a little bit about each patient and can help our teammates if they're in a critical situation. As far as the rest of the shift goes, most of the time you're doing every 4 hours, you're doing a full physical assessment, and then whatever else the doctor orders, because obviously if they're a neuro patient, we might want to do the neuro assessment on them every hour instead. So all those are just patient specifics, but otherwise, when it comes to days versus nights, days are definitely a lot busier. We're talking about more bedside procedures, patient and family education. Sometimes we're traveling to go to CT or MRI or the operating room. And then we're trying to establish as a team, what their plan of care is going to be, and how we're going to get them from point A to point B, and hopefully transition out of PICU. So a lot of the decisions happen on daytime, just because at night we don't want to rock the boat and change something that causes a patient to decompensate. So at night, we are very focused on sleep hygiene. This means, getting kids to bed on a normal schedule, really trying to cluster those cares and make sure that we're doing focused physical assessments and interventions, just so that they get a chance to rest uninterrupted throughout the night, as long as they're stable. If they're not stable, unfortunately, the sleep hygiene aspect goes out the window, and we're doing everything we can to just stabilize them. But yeah, the guaranteed things are the Q4-hour full assessments, unless otherwise ordered. We do very strict intake and output of our patients. It's very important to know what's going into them and how much they're putting out. because fluid balance in children is very, very important, and it can cause serious harm if they have an imbalance. So that's part of the reason why a lot of patients remain in the intensive care unit, is that they need very close observation. We do medication administration in several different forms, and then charting and documentation. Charting is life when it comes to nurses anywhere in the healthcare system. So that's kind of just a synopsis of what a day in the life is. But why I chose pediatrics is that to take care of a parent's most prized possession and give a child the opportunity for a brighter tomorrow has been a very driving force in my life and given me purpose in what I do from day to day. And kids are so resilient. They bounce back quicker than any adult patient I have ever cared for. Patients, their parents, and their family members are very optimistic, as well as our provider staff. We want to do everything we can to improve their outcomes, regardless of what they come in for. And everybody just seems very hopeful. We try to promote resiliency within ourselves and within our patients and parents and families, and give them realistic goals for their care. So I always say, just trust the timing of your life. So wherever you are in your journey, make sure that you're present in that time, and wherever you want to get to, you'll be able to get there. But I think we have about 10 minutes left, and we can open up for questions. I need to just figure out how I can get to the chat. Okay, I can see it finally. So if you had questions, go ahead and drop them in, and I'll just try to answer them one at a time. So it's from, is it Reedy? I'm in high school and I'm thinking more of pediatric cardiologist, but I'm still thinking about nursing. That's excellent. The path to being a pediatric cardiologist is very long, but I adore our peds cardiologists. They are some of the most well-rounded professionals, and it is a very different career path. So that would be going more along the doctor route, which that's you would take a bachelor's probably in like biomed or something like that, and then take your MCAT and apply to a medical program, which is another 4 years on top of that. You would go through residency and then another residency after that. So I don't think I can speak too heavily to that, but if you need help getting connections there, I can definitely point you in the right direction of who to talk to. What are some aspects of a nurse residency? So not every hospital actually offers a nurse residency. Typically those are magnet certified hospitals that have reached, magnet is a nursing excellence designation that has to be obtained by that hospital. It's a lot of work that goes into it. And currently my institution, we are going for I think it's our 4th year applying to be magnet certified. So far we've attained those for 3 years in a row. The nurse residency was a monthly class and had an end project that we presented on to our class, but they just teach you more about the steps that baby nurses go through, resiliency aspects, and like protocols throughout the hospital that might be confusing. So we had a bunch of speakers that would come in each month that we were required to go to this class, and we had to finish it. I think we had to finish it in 12 months, because then that's when, if you didn't pass that, which was very unlikely, you would be terminated and you weren't able to become a Kline 2. So overall, it was just an extra class every month, which meant extra money. They were helpful. As an OR nurse, it wasn't super helpful to me because procedural areas were just so different than the rest of the hospital, and a lot of things they were speaking to did not apply. So that's a great question. But nurse residencies also get you master's degree credits. So I got 3 credits from completing that to go on to a master's level. So that's another thing to think about. Was there a case that was particularly interesting? Is that as far as patients patient cases? How was it when you first started working in the ICU? When I first started working in the ICU, of course, I was scared, but I had a fantastic preceptor for daytime and nighttime. They were both very experienced PICU nurses with years of experience under their belt. So they really helped guide me. And it's not that I didn't have any critical thinking skills, but I just had to get into the flow and the logistics of the bedside and trying to be 3 steps ahead of a patient that took a little bit of time. I managed family and social life and mental health, working 36 hours a week by working out and having a set schedule and saying no to things that I didn't want to do and really being, firm in my boundaries. My husband was very supportive of me transitioning to this and having to switch to a day-night schedule. That was definitely hard because I worked all days in the operating room. But the days that you work, you're there. Your mental focus needs to be there with your patients, not anything outside of the hospital. So that is just something that I ground myself in when I go to work. And then the same thing, when I'm outside of work, I do not think about work. It's, those are my scheduled hours, and that I just have a very big separation in those two. How do I cope with stressors? Working out is how I cope. I also talk with a lot of my older nurses about their experiences and if I can do anything better. If it's something that, I feel like I've done something wrong or that I need to improve upon my practice. Just always continually being a lifelong learner, seeking out those opportunities. I think that helps decrease stress. I also think that you can never be too overeducated. So a lot of what causes me stress is the not knowing certain things. So continually signing up for CBLs and continuing education credits, that was very, very important to me, mediating stressors of my job. Any specific classes in high school? Honestly, not that I can speak to. I know that there are, like more science-based classes that you can prioritize in your high school schedule. I took the EMTB through my high school, and that really, I think that set me up for success because I had a foot in the door as far as, providing care to other patients, even though it wasn't in a hospital setting, it was in like an outside setting. For medicine/nursing, should I take the CNA or ER tech class at my high school if I want to go into the medical field? If you have the opportunity, absolutely. I think that is awesome. If you have CNA experience, you're going to be right there at the bedside with those nurses and doctors, and you'll be able to see things and have experiences that you otherwise would not have. So if you can get into those and your lifestyle permits you to do that, I would absolutely look into it. It is hard and stressful, and CNAs and ER techs are just so important to us taking good care. It's a hard job, but we definitely still need them. And yeah, if you have the opportunity, absolutely. Are there any benefits to working night shifts than day shifts? Oh, absolutely. On night shift, you get a shift differential, so you get paid more money because you are flipping your schedule and your normal equilibrium to work night shifts when you should be actually sleeping as a human being. In my institution, we do remote parking, so when I work nights, I get to park closer to the hospital, which is great. And then same thing, the workflow is just a little bit different. We're focusing on just managing that patient and getting them through the night. We're not trying to make big swings in care unless we have to stabilize them. So yeah, there's a couple benefits. Before being an OR nurse, do you need to be in every department of the hospital? No, you do not. OR nursing, they do allow a handful of Kline ones depending on what type of institution it is. But maybe if you work in a procedural area or outpatient setting and then want to transition to OR nursing, it's great. And you know what? They make a lot of money. I did take a pay cut in transitioning, but I just knew that that I needed something else for myself. Do you have a specific patient case that you remember distinctly? There are so many patients. And then how has coronavirus affected your routine in the hospital? We are a lot stricter. We're just a lot stricter on who is allowed in, how we assess a patient for being a potential to infect our staff members. And, you know, our teamwork has definitely improved. Yeah. And I think we have like less than a minute. So if anybody has any other questions, feel free to find me on social media. I did drop a questions box. These are my handles, and that's my email. It's the same thing as my handle at Gmail. So if you have any other questions, please feel free to ask them and reach out to me. I will be around the rest of the day, even though we only have 40 minutes on here. But thank you so much for attending on a Sunday, and getting some experience and listening to me talk about my journey in nursing. Wherever you guys are and whatever you're thinking about doing in healthcare, I wish you the best of luck. And it was just lovely to share this time with you.